Is it safe to take gabapentin and Suboxone together? Gabapentin and Suboxone are two medications that are often prescribed for different reasons. Gabapentin is used to treat seizures, nerve pain, and restless leg syndrome, while Suboxone is used to help people overcome addiction to opioids. Some may wonder if taking these two medications together is safe. This video explores the risks and benefits of taking gabapentin and Suboxone together. Let's begin. Gabapentin is a prescription medication that is most commonly used to treat seizures. Gabapentin belongs to a class of medications called anticonvulsants. Anticonvulsants affect the central nervous system to reduce the number of seizures a person experiences. Gabapentin is also commonly used to relieve nerve pain after surgery or due to conditions such as shingles or diabetes. Gabapentin does not cure these conditions, but it can help to reduce the symptoms and improve the quality of life. Gabapentin is not a controlled substance tagged by the FDA, but it is a Schedule V controlled substance, which means that it still has a low risk of being misused or abused. People taking gabapentin, especially in high doses, should be aware of the dangers of this medication and take precautions to avoid misuse or addiction. If misused, gabapentin can lead to a euphoric high and may be habit-forming, with various unpleasant side effects, including drowsiness, dizziness, and confusion. No, gabapentin is not an opioid, meaning it does not act on the same receptors in the brain as opioids like Suboxone. Gabapentin is classified as an anticonvulsant, while opioids are a class of drugs that includes morphine, fentanyl, and heroin. Gabapentin is a medication for treating seizures and nerve pain. It is also sometimes used to help with hot flashes, restless leg syndrome, and anxiety. Some scientists believe that gabapentin can help with the symptoms of opioid withdrawal. However, the FDA has not approved gabapentin for this purpose, and more research is needed to determine its effectiveness. If you are struggling with Suboxone or opioid withdrawal and looking for other options to manage your symptoms, it's best to talk to your Suboxone doctor about treatment options. Gabapentin has significant interaction with Suboxone and other opioids. In fact, due to the nature of these two medications working on the central nervous system, taking them together can cause various unpleasant side effects. Some of the most common symptoms include lethargy, drowsiness, confusion, slower heart rate, and difficulty breathing. Suboxone is a prescription medication used to treat opioid addiction. It is a combination of two drugs, buprenorphine and naloxone. Suboxone comes in the form of a dissolvable film placed under the tongue. Buprenorphine is an opioid partial agonist which binds to the same receptors in the brain as other opioids but produces a weaker effect. Naloxone is an opioid antagonist which blocks the effects of other opioids. Together, these two drugs help reduce cravings and withdrawal symptoms while preventing abuse. Medical professionals are still studying the effects of gabapentin and Suboxone when taken together. Generally, it's still not recommended to take gabapentin and Suboxone together, as there are a lot of potential risks involved. But there are rare cases when a doctor may prescribe these medications together to help manage certain conditions or symptoms. So, yes, it is possible to take gabapentin and Suboxone together, but only under the close supervision of a medical professional. If you consider taking these medications, talk to your doctor about the possible risks and benefits. And remember, it's always best to consult a qualified Suboxone doctor who can help you weigh all your treatment options and guide you toward the proper care plan for your unique needs. Central nervous system depressants like gabapentin can interact with Suboxone in dangerous ways. Taken together, they potentiate each other's effects, which means that their combined effects could be more potent than either drug. It can lead to several severe side effects, including respiratory depression, slowed heart rate, slowed breathing, lethargy, and, in some cases, death. Despite the low risk of gabapentin being misused, it is still possible to overdose on this medication, especially if the patient taking it has a history of abusing opioids. Suppose you take Suboxone and gabapentin together. The risk of an overdose is even higher. So, what signs may you be experiencing a gabapentin-induced opioid overdose? Some common symptoms include lack of coordination and confusion, slowed breathing, nausea and vomiting, muscle weakness and limpness, drowsiness, unconsciousness, bluish and clammy skin, diarrhea, double vision, slurred speech, changes in behavior or mood, If you experience these symptoms after taking gabapentin and Suboxone, it is crucial to seek medical help immediately. You can recover from a gabapentin-induced opioid overdose with proper care and treatment, and get back on track toward better health. Now that you know more about the risks and potential side effects of taking gabapentin and Suboxone together, you may wonder where to go from here. If you need to take gabapentin while on Suboxone, you must speak with a qualified Suboxone doctor. At SuboxoneDoctor.com, our qualified Suboxone doctors and compassionate medical professionals can help you weigh the risks and benefits of taking these medications together. They will work with you and recommend other treatment options that may suit your needs. So don't hesitate. Consult a Suboxone doctor today to get the guidance and support you need to achieve lasting recovery from addiction. Visit SuboxoneDoctor.com.